Hello friends, the question is, are there any diseases that are linked to psoriasis? So let me tell you first of all that there are certain conditions or certain people who are more prone to psoriasis, and if they have a tendency for psoriasis, they should avoid these things. So the number one thing is that the obesity. Obesity is one of the trigger factor for psoriasis, and which is due to lack of exercise, improper diet, lack of sleep, and so many modern lifestyle or unhealthy lifestyle, eating fried foods, eating too much, stress. So all these things cause obesity, and definitely these things are the cause of or the trigger factor for the psoriasis. So obesity is also one of the trigger factor for psoriasis. So one has to avoid these things to delay or to control or to manage obesity. Although psoriasis is a genetic disease, and if these things are there, these are the trigger factors, psoriasis is likely to precipitate. So avoid these things that you may not get psoriasis or you can delay the psoriasis. The second part of this question is that diabetes, hypertension, cardiac related disorders, myocardial infarctions, heart attacks like that, are they linked to psoriasis? So the research says that these diseases are the chronic inflammatory diseases, and psoriasis is also one of the chronic inflammatory disease. So all those patients of psoriasis have almost double the tendency of getting these diseases if they have psoriasis. That is the reason that if you have a psoriasis, you should be on the watch and you should be careful so that you may not get diabetes, or you should avoid all those things that may cause you diabetes, or that may cause you heart disease, or that may cause you all this chronic rheumatism and all these things. So if you have psoriasis, not only take the treatment or take care of psoriasis, but take care of your general health so that you do not invite these diseases, because they are linked to psoriasis. One of the most important, last but very important thing, that you cannot avoid it, that is 50% of the patient who have psoriasis, they land up in a type of arthritis called as psoriatic arthritis. So if you are having psoriasis, so you must be on watchful, you must be careful so that you do not get psoriatic arthritis, or you can delay the psoriatic arthritis if you take a proper care of your body and the treatment of psoriasis regularly. So all these things you can go and consult your doctor how to avoid psoriatic arthritis, and we have made the videos about that in our YouTube channel. Kindly go through it. Thank you.